anything that is related to science, medicine and surgery ought to be the prerogative of the British. Because Indians can't be scientific, right? Keeping this as a background, how Sushruta, who lived some 2000 years before, in the 6th century BCE in Kashi, is considered as a father of surgery in an era where any form of modern technology was absent, to the extent that tools and machineries were primitive and handmade, at a time when even Jesus was not born. Because it was Sushruta who managed to perform several of these complex and fine surgeries like the cataract surgery, plastic surgery, C-section and even the brain surgeries. But how was Sushruta able to perform all these surgeries? How was he so well versed with the human anatomy? In order to understand the human anatomy, he would submerge the dead body in water for several days until decomposition. He would then run his hands through the specimen to understand the various organs in the body, and he would understand the various layers of the skin and the depth of the muscles as well. In fact, every practitioner who wanted to follow Sushruta had to undergo such intense training for 6 years. They had to run their hands on vegetables, dead animals and even the rotten woods, and had to be very comfortable with the various layers of the skin until they had very good understanding of the human anatomy. His book Sushrut Samhita is considered as one of the 3 foundational texts of Ayurveda, India's most traditional form of medicine. Sushruta Samhita describes about 1120 types of illnesses, around 300 odd surgeries, 120 surgical equipments with 700 medicinal plants, all still holds relevance today. Particularly, Sushruta was an expertise in rhinoplasty, which involves reconstruction of the nose by taking a flap of skin from the forehead to create a lost nose. In India, it's a common practice to cut off one's nose, which is considered the most humiliating form of punishment. And what best one can ask for? The cure is already available. Performing the surgery of rhinoplasty was so common in India that such surgeries were performed in every villages of India and was even taught in the Gurukul education system. During the Second Anglo-Mysore War, in the 1780, Hyder Ali cut off the nose of British General Eyre Coote. With the nose in one hand, humiliated to the core, unable to return to Madras, Eyre Coote was roaming on the streets of Belgaum, wherein an ordinary man from the village offered to reconstruct his nose through the surgery of rhinoplasty. After the successful surgery of rhinoplasty, Eyre Coote returned to London and he stood in the British Parliament. None could distinguish his reconstructed nose. For Eyre Coote, it was nothing less than a miracle. A surgery like rhinoplasty, which was very common in India, was nothing short of a dream back in Britain. British were so astonished to see even a common man like a potter perform the surgery of rhinoplasty on the streets of Pune, and it was widely reported in the Gentleman's Magazine in the year 1794, giving an illustrative account of a potter performing the surgery of rhinoplasty on the streets of Pune. This report on the Gentleman's Magazine is said to have kindled the interests of many of the practitioners in Britain, and many physicians travelled to India to study this technique of rhinoplasty from India. One such man was J.C. Cupp, who spent his 20 years of life in India studying this technique, and it was only in the year 1814 that he was able to perform his first successful surgery of rhinoplasty. They came here, studied here, and all went back to Britain to popularize this surgery, which later came to be known as plastic surgery. Remember, that was the time when not even a single successful surgery was able to be performed by the practitioners back in Britain. Ancient India thrived as a center of medical tourism even back then. Particularly the Arabs were so influenced that the Caliph Al-Mansur ordered this book to be translated in Arabic called as Kitab-e-Sushrut, which later made its way to Europe. In the 9th century, even the Khmers of Cambodia seem to have known the popularity of Sushrut Samhita as much as the Tibetans. There seems to be no end to Sushruta Samhita's popularity even today. There is a statue of Sushruta in the Medical College of Australia. In the 19th century, Sushrut Samhita was translated in German and Italian. And somehow we have seen to have forgotten this knowledge which was so commonly practiced in India after the 19th century. After all these things said and done, look at the audacity of the British. They considered Indians to be white man's burden. So much so that they called Indians to be barbaric, backward, superstitious, uneducated and the least unscientific. Apart from ripping India apart of a glorious wealth and knowledge and leaving India partitioned in a dilapidated state, what else is the legacy of British?